Our next speaker is Dr. Pilyoung Kim. She is an associate professor in the Department of Psychology and the director of Family and Child Neuroscience at the University of Denver. She received a PhD in developmental psychology from Cornell University and received a postdoctoral training in developmental affective social neuroscience at the National Institute of Mental Health. Dr. Kim researches the structural and functional plasticity in mothers' brains, and such plasticity supports parents' psychological adaptation to parenting and sensitive caregiving for infants. She has over 50 publications and was awarded the Victoria S. Levin Award for Early Career Success in Young Children's Mental Health from the Society of Research in Child Development. Please welcome Dr. Pilyoung Kim.
Okay, so thank you so much, and Joy and Apple, to invite me to be here. I'm really honored to be in the same room with you and have important discussion to help the mothers during pregnancy and the early postpartum period. I share very similar ideas that I do think that every parent, from whichever the background, have a right to parent their children in a safe and supportive environment. So I see my role as a researcher to provide scientific evidence that can be helpful for the important works that some of you doing in the clinics and in the field. So yes. And my first name is a little hard to pronounce. It's Pilyoung. It's a Korean name. So I tell people it's like a singer named Neil Young, but it starts with P. But I have to come up with new way because I realize younger generation don't know who Neil Young is. I was like, where's that person? Okay, so the overview is sharing some of the research that I did and some other people did, showing that the human mother's brain change after they have baby. And then because it's a period with a lot of brain plasticity, the brain develops during this period of time to actively support parenting. It is also time the brain can be receptive to environmental influences that can be both negative and positive. So I'm going to share some evidence that especially if the mothers are experiencing really high levels of stress, how that can be related to some different changes in the brain that can result in some negative outcomes that we care about. And then last, I'll do some brief discussion about how this is the window of vulnerabilities and opportunities so that we can transition to panel discussion. All right, so I think that this is the audience that I don't think that I have to say much about, but I think generally, I think the public thinks that the parenting is, natural and it's instinct, it's beautiful, but I think people who have had children before or have seen people who had children know that it is really demanding and stressful experience. So just like, example here, the newborns is fed like, 8 to 12 times every 2 to 3 hours. So this mom is actually like documenting that she fed her child 3 a.m. and 5 a.m. and 9 a.m. It's like a 24-hour cycle, right? And the left-right is basically which side of the breast that she used to breastfeed, because we're so sleep-deprived, we can't remember, right? When this is true that the parenting does have this side that, it is very stressful, it requires a lot of sacrifice from the parents, both psychologically and material, from point of view. And then, for the scientists like me, I have to wonder then why we parent our children. Why do we have a child, right? Because for the first time, we can say that, I didn't know how hard it was. But I have 2 kids, so the second time, did I forget everything? So, for humans like us, we don't like to do things that's really hard. But it's really interesting that, for the generations and generations that we're willing to sign up for this really hard, life-changing experience, there has to be some mechanisms in us to motivate us to do this and support us to do this. So that is the question that I ask a lot in my research. So what is it that motivates us to have one child, two children, and willing to sign up to care for that child for 20 years or 30 years or 40 years, and yeah, if you're lucky, right? So, we think that one of the really important factor is that that emotional bond we make with our children is very rewarding. So these are the pictures of my two sons. But that smile, that eye contact that they have with me, the sweet smell, the soft tactile when I hug them. I mean, just thinking about it makes me my heart just swells. It's that kind of a feeling that I cannot really describe. It's just a really different kind of positive feelings that we have. And indeed, brain actually helps us to feel that way. So, brain has this number of the connections in the brain areas that we call the reward circuitry. So these brain areas respond to anything that makes us feel really good. So that could include food, drug, sex. But when we have baby, these brain areas are particularly sensitive to babies, especially our own babies. And that helps to bring this positive, really content feeling, and also makes us feel like, I want more, So, that helps us to, not only to feel motivated to take care of our children, but wants to have one child and two children and three children if we can, right? And indeed, so this is the part that I just talked about, that, the mothers have this increased kind of reward sensitivity to the baby because of that brain circuitry. And we share very similar brain circuitry with all the other mammals, actually, because, we are in a way that programmed to do this, evolutionary. So other mammals also have a very similar, this reward circuitry that's very important for parenting. And like I said, this brain area also responds to other very rewarding things. So for example, rodents like rats and mice, the females, they don't show any maternal instinct before they have baby. But once they have their own pups, they become actually a very dedicated mother. So what happens is that before they have their own pups, they also like cocaine, just like, human. So they like to get as much as of that, if they could. But what's really interesting is that once they have their own pups, that preference switches. So even though they have option to access cocaine, they actually prefer to spend more time with their babies because their reward circuitry more strongly responds to their own babies. It brings them more joy and the pleasure. So this chart basically highlighting that early postpartum period, which is the period that when pups need the mothers the most, you see that in this gray bar that the mothers spend more time with pups than access cocaine. But the late postpartum period, by the time when the pups are more independent, mother's preference switches. So as you can see in the black bar, that this rat mothers spend more time getting cocaine rather than spending time with their pups. But having the motivation is one aspect. The other aspect is that we need to be able to manage the stress that comes with parenting. So that is what we see in the mothers during late pregnancy or early postpartum period. It seems like there's biological mechanisms help us to have more kind of reduced stress response. So the typical mothers may show that they don't seem to be stressed out about by the things that they would normally be stressed out about, so that we can be a better mother to focus on the role of parenting. And we see that also in the brain mechanisms that, that mothers show like greater prefrontal cortex activations when they're listening to baby cry, for example. And when we do the surveys with mothers and also the fathers, actually the blue bar is the fathers, what we see here is because of this support from the brain and other hormonal mechanisms that, while it's really normal to have some increased anxiety right after they have the baby, so for example, like 2 to 4 weeks postpartum, that kind of normal increased level of anxiety will subside a little bit by the 3 to 4 months postpartum. Of course, we're very concerned if the mothers have really sustained high levels of anxiety or depression during this period of time, but typically that these levels will go down, and what happens is that over time, the mothers start feeling more positive about their own baby and also about the parenting, which is really the critical mechanism for us to feel like rewarded in the parenting role. And we may be also concerned if there are parents who don't have this type of a transition, that they remain very anxious or depressed during this period of time, which may be related to the fact that they have really hard time to feel positive about their own baby or the parenting itself. And like I said, for the reward part, the motivation part is really strongly involved in the middle brain regions like substantial nigra, ventral striatum, or nucleus accumbens, and amygdala. And emotion regulation also involved many different brain regions, but if I highlight, that would be prefrontal cortex. So we see increased prefrontal cortex activations when we present baby stimuli in the scanner, for example. So many years ago, we were really interested in that, non-human animal work showing that there's brain structural changes after the parents have baby to support the psychological processes, feel more motivated to care for children and have more increased emotion regulation. But we weren't really sure whether that could be true for human mothers. So when we actually invited the mothers to come twice to the fMRI scanner and took the picture of their brain at first months postpartum and again 3 to 4 months postpartum, what we saw was that structural increase during that first few months postpartum period in the brain regions that's highlighted in red. So it's quite a number of brain regions that show structural increase during this period of time, and they're really critically involved for parenting, detecting the baby cues and learning and decision making, emotion regulation, and so on. So not all changes negative in the brain. Like, we talked about mommy brain, and I definitely experienced that, but perhaps not everything is negative during this period of time. And importantly, we saw that structural increase in the reward area highlighted in the circle, the yellow circle, was also positively associated with the mother's feelings about their baby. So the greater structural increase in the reward area was related to more positive perception about the baby. So the way that we measured it was that we present a number of the positive and negative words and see how many of the positive words that the mothers choose to describe her baby. So the more words that she used, like adorable and beautiful, were associated with the increased brain structure in the reward area. So this was, a kind of part of the evidence that how we feel as a mother and the changes in the brain might be related. And we replicated this finding in more kind of socioeconomically and ethnically and racially more diverse sample. So the later postpartum months were also associated with the greater cortical thickness in the prefrontal cortex, in the color regions here, and even also stronger functional connectivity, meaning that different brain regions actually communicate a lot stronger. That we found that in the later postpartum period. So these all supports that the mother's brain go through really dynamic changes after they have baby, which is not very surprising actually to me that how intensive the parenting experience is. So, if we talk about learning, this is really intensive learning experience, right? And of course, the brain changes to support and reflect that experience. I should mention, though, that this is not my work, but others also have found that during pregnancy, the brain also shows structural decrease. And it seems that the mother's brain overall during this period of time will go, experience wax and wane. So during pregnancy, the idea is that when the some of the brain regions here highlight here, so this is pregnant woman. Woman. So as you can see here, the structural decrease there seems to be related with the higher estrogen level during pregnancy, which then relates to some pruning in the brain area, meaning that the brain actually kind of get rid of some of the connections between the neurons in the brain area they don't need. So in a way, they're kind of preparing the mother's brain to communicate more effectively. So again, highlighting that the mother's brain goes through really dynamic changes during this period of time, which it can be considered quite unusual for the adult brain, that we consider adult brain's structure and function might not change as drastically, but it seems like the pregnancy and postpartum period exception. Because of these findings, a number of the people consider the perinatal period, like pregnancy and postpartum period, might be really the window of vulnerabilities and opportunities. The fact that the women are particularly vulnerable to prenatal and postnatal psychopathology during this period of time might be related to some of these brain changes, but also maybe a window of opportunities that the brain also receptive to positive experience or intervention and support. But first, to focus on some evidence that we see the mothers, the postpartum period is really hard period for any mother. Like when I had my first kid, I already knew something about parenting because I was already studying the topic. But, so I thought I was really prepared. And my mom was like, you don't know anything. And when I actually had my first child, I was so surprised. I remember, crying really hard in the bathroom. I didn't know how hard it was. And so it's really hard experience for any woman. But we know, I think from some of the examples or our personal experiences, some mothers are particularly vulnerable during this period of time. And one group of mothers maybe is that the mothers who are already experiencing really high level of stress, and then they have to manage parenting on the top of all those burden and stress. And then that environment, one of those environment can be represented by poverty. So I thought it would be important to study mothers who are experiencing poverty and how that really high level of stress can perhaps disrupt these normative changes in the mother's brain. So for poverty, I think many of you already know, so I might not have to mention this, but in research, the way that we define is based on their family income. So for example, the federal government has annually adjusted poverty lines. So for Colorado, 2019, for the parents, the family of 4, 2 adults and 2 children, the poverty line was around $25,000, that's annual income. So if the family's total annual income is below this line and their income to needs ratio is below 1, and by definition, they're living in poverty. And low income will include these families as well as the families, their income to needs ratio is below 2, so maybe about 50,000. And we call them all as a low income families because that is still not the enough income for them to meet the basic needs. So in US, about 40% of all families are living in low income, which is really kind of high percentage. And then when you hear also socioeconomic status, that can be represented by income or education or occupation, any combination of those. And the mothers who are living in poverty, not too surprisingly, on average, experience high levels of psychological distress and more stressful events. And this has been highlighted as a major risk factors why they may be more vulnerable to postpartum psychopathology like a postpartum depression and negative mother-infant relationships. And I think for that reason, these mothers have been targeted for some of the interventions during this time to provide more support. And how the stressful experience during this period of time can be related to the brain changes in the mothers. I look into some literature of the non-human animal work because they can really do elegant work of manipulating their environment. And when they're manipulating the environment with the conditions like unstable and crowded housing and like kind of material deprivation, meaning that they provide very limited amount of like nesting materials to these rodent mothers that cause these mothers to have more anxiety and have more impaired parenting behaviors, as well as more reduced, altered structural and functional activation in the reward circuitry and the prefrontal cortex. So this seems to suggesting this causal associations, this unstable, a limited environment and stressful environment, and the risks for postpartum psychopathology and the parenting through the brain mechanisms. So, but for human mothers, we don't quite really know whether there could be a very similar story. So we investigated that. So the question is that can stress can get into the maternal brain? Particularly the brain circuitry that are related to parental motivation and emotion regulation. So the first study that we did with the mothers at a range of income status, that what we found was that the lower income was related to reduced prefrontal cortex response when they're listening to baby cry. We typically expect these areas to be increased, have increased activation when they listen to baby cry, but unfortunately, the mothers with the lower income show reduced brain response to baby cry. So in the brain area highlighted here, the lower income was associated with the lower brain response. This was an important finding for us. However, though, we don't want to stop there, that poor mothers may have a last brain response. It was important for us to investigate more that what aspects of the poverty can be related to the differences in the brain response to baby. So for that, we focused on their experience. So, I've been working with families living in poverty, more than 15 years, and what I see over and over and over about something a little bit more unique about living in poverty or experiencing poverty is that the people are more likely to be exposed to multiple major stressors at the same time. So stress is not unique to lower income people. Like I have stress, you have stress, we all have stress. What's more unique though for the lower income families that they experience multiple major stressors at the same time. And I think that's particularly toxic to our brain and body because it immobilizes us to cope with any one of those stressors because it really overwhelms our system. So, for example, in this, although this is the family with children now, but when we asked them whether they were experiencing any one of these stressors, like exposure to violence, family turmoil, family separation, noise and crowding in their house and housing problem, any one of these are really major stressor for the families. But as you can see here, the black bar is the middle income families that, most of them, maybe like about half of the middle, they do experience one of these risks, right? But it's very rare for them to experience 3 and 4 and 5 risks at the same time. However, the white bar, which is the poverty families, they're a lot more likely to experience 3 and 4 and 5, or actually all of the risk factors at the same time. And this idea is very similar to maybe something that you've heard a lot lately, which is ACEs. The adverse childhood experience. So basically, this is the survey they ask people about how many of these adverse experience they had in their childhood, and there's 10 different items. And the more number of the experiences that people have, it's quite robustly related to more negative health outcomes. So here, the more number of ACEs are related to, more risks for depression, more risks for cancer and obesity, and so on. So it's very similar kind of concept that people experience multiple adverse experiences that really can impact our health at a multiple level. However, the cumulative risk, the other way to call it, hasn't been focused as much for the kind of maternal health outcomes. However, there are some studies suggesting that indeed cumulative risk or experiencing multiple stressors at the same time are particularly a risk factor for, like, for example, postpartum depression. So if you look at any one of the risk factor at a time, it doesn't necessarily increase the risk for postpartum depression. But if you see the mothers who are experiencing multiple risk factors at the same time, they're at a greater risk to experience the postpartum depression. Similarly, the cumulative risk has been related to more parenting stress and more difficulties in the parenting. So in this study that we had 53 first-time mothers were relatively ethnically diverse. And then the risk factors we focused on in this study were 9 different risk factors. So 3 socioeconomic risk factors like low income, financial stress, food insecurity. The other 3 more environmental risk factors like living in noisy and crowded house or the substandard housing quality, and the other 3, the psychosocial risk factors like marital dissatisfaction, violence in the community, and the troubles with authority, like social services. As you can see, any one of this can be major stressor to postpartum women, but we had mothers who ranged from 0 to 8. So there was a mother who experienced 8 of these risk factors simultaneously. And the way that we present it, the measure of the brain activation is that when mother is in the scanner, we play baby cry sound. So one is her own baby cry sound, and then we also have a control baby sound. So I wanted to play a sample of that. Okay, so that was just a 5-second. Our participants listened to this 20 seconds at a time for probably 20 times in the scanner. So this is a very powerful paradigm to activating the brain areas that are involved in parenting. Makes mom to feel like get up and go to this baby. We have mothers in the scanner teared up. Because they're thinking about their baby. They really want to care for this baby. And what we found was that the cumulative risk was associated with more dampened brain response to the baby cry when they're hearing this sound. So more stressors related to less brain responses. Again, in the prefrontal regions, that might be particularly important for emotion regulation, so as many other things. And another region that also we found was the superior temporal gyrus, which is really important for processing the baby cry. So this might indicating that some kind of brain level challenges of regulating her own emotions when she's listening to her baby crying, if the mother is experiencing really extraordinarily high levels of stress. But also this reduced brain response was related to more less sensitive behaviors that we observed at home when we videotaped her interaction with her own baby. So the last maternal sensitivity with last brain activation. So just for this study that, we think that cumulative risk during postpartum period can be related to more dampened brain response to baby cry, which can increase her challenges to respond to her baby sensitive way. Which is, I think, a reason why we might want to care more about the postpartum environment, because perhaps it's possible that if we change the cumulative risk or adverse postpartum environment, that we perhaps can change her brain response to her baby and also the behavioral response to the baby so that she can have chance to develop more positive relationship with her baby and develop more deep bonds with the baby. So if I summarize that, I provided some of the examples that perinatal period is a window when the maternal brain may be vulnerable to stress exposure. And one thing that I want to highlight here, though, that because the associations between income is gradient, linear, so that means it's, this association is not exclusive to low-income women. The woman at any income range can be actually influenced by the association between the income and brain response and parenting. Therefore, I think it applies to all women that I think we should care about all women who are experiencing stress and what that impact may be on her brain and behavioral adaptation to parenthood. And perhaps, cumulative risk or the multiple risk exposure can be target for identifying mothers who may be at a greater risk for like postpartum depression or more kind of negative adaptation to parenting. So, just like ACEs, I put together maybe as an example like 10 different risk factors for the maternal health outcomes based on the literature. So I would love to receive people's feedback and see whether this might be a good idea. But I think just like ACEs, I think we could use something like this to show really robust associations between the postpartum environment or conditions and the maternal health outcomes. So those can include, low income, single parenthood, young age, like a teenage mothers, housing and the food insecurity, exposure to violence, like interpersonal violence at home, but also in the neighborhood, family separations, like a divorce or the husband going to jail, for example, history of psychopathology or substance use, or the mother's own experience as a child being abused or neglect. That has been also very powerful risk factors for negative postpartum outcomes. And the last thing that I want to mention is just like I said, I haven't, and I think other researchers haven't had a lot of opportunities yet to show a scientific evidence. But I think we have a reasons to believe that when the brain is receptive to negative experience, it's also receptive to other kinds of experience, like a positive experience too. And during, what we anecdotally notice, I think that others may can speak this better, but, the mothers during pregnancy, they show quite a bit of motivation to kind of change. They want to stop, their drug use. They will say something like, I don't want my child to experience the same thing that I did. But I'm not really sure, whether we're kind of utilizing that opportunity at the best, that, when the mothers are actually quite motivated to make a change for themselves and for her baby. So perhaps, we care so much about these new families and the children, it's important to focusing on providing more positive environment and experience for the woman so that, she is more empowered to provide a safe and supportive environment for her children and the whole family. So thank you.